right?
For the water and electric utilities,
Yeah.
yes.
Yeah.
Yeah.
So I mean, I guess,
So the question is,
why here and
can't you
why
show it
not
under
fringe? Yeah, why here and not fringe?
Once again, I have to have an account to charge it against. If
But
you
why
want me-
wouldn't that account be fringe benefits?
It could be.
Well, he's just saying for consistency.
Right, just for consistency's sake, because my insurance costs are not showing up in a line item for municipal departments under overhead,
Yeah.
why wouldn't, let's clean up this.
But the other way to look at it.
No, I understand exactly. What I would do is, on the page B5, what you're asking is for consistency in budgeting.
Yes.
So you see 1, 2, 3, 4, 5. You see 6 accounts there?
Yep.
Well,
Blow out
514 and 528 would be removed and placed in another bracket.
Well, 514 is insurance.
Yeah, I'm not sure,
So
right.
that's over, I see that as overhead, because that's, if an employee leaves the electric utility, the health insurance goes down, because that's directly tied to personnel. So we want to have all those personnel costs stay there. But liability insurance is overhead. That should stay there.
That's fine.
Yeah.
Yeah.
We can remove
That one
that.
I wouldn't move, but
Okay.
I agree with Bob, you beat me to the point on that one. I wouldn't move the JIF item, I'd move the dental, health and dental.
And Robert, isn't the other issue, the actual employees who operate the utility and run the electric department are actually reflected in the field section of the budget? And when we're looking at the electric administration, those are just basically 20 people who do some work, like myself and yourself.
Yes.
And we're allocating portions of salaries. It's not the people who are actually operating the utility. That's another reason why it's reflected that way. It's just, it probably makes it more confusing.
This is kind of an allocation, like budget, allocation department as opposed to.
Correct, as opposed to the actual line item.
Actual true
Right.
department.
If you look at the
But I
field,
still like
those
the
are the
other
actual,
personnel.
That's fine.
Robert can do it.
Yeah, I want to call your attention to one item, account 215, professional fees. Now, that,
There's a number.
the 61,000 number holds our payroll processing for the electric utility, our fixed asset reporting, the audit fees from the auditor, since he bills them separately, and legal fees. Now, when I prepared this budget, I think I robotically looked at the number, okay, and put this number in, since I know we're going to incur legal fees. However, Ray, the explanation is for the new purchase power contracts that the fees that we spent with Joe Barker.
Right.
Well, we're not going to have that.
We got a 5-year contract, right?
So I'd like to remove 20 from here.
I'd like you to do that.
We would too.
However,
Zero.
there's a however. However, I'm sorry.
Yeah.
So instead of 61,000, it's going to
It's
become
41.
41?
Yeah,
Okay.
I feel comfortable with that.
Back up a little bit for me, Robert.
Yes.
That payroll fee, the
Yes.
ADP payroll fee, what is that?
Automated data processing.
Well, yeah, what is it for? For all the employees
It's-
or
it's-
just the list of employees under this specific account?
This is very similar to the health insurance and the liability insurance. We received one bill, and it gets allocated to the different departments. A piece stays in the current budget, the municipal budget, a piece goes in water, a piece goes in electric, and we don't allocate any fees to the library. We haven't so far.
Okay. Similar discussion 5 minutes ago. You mentioned the library. What about the health department? Do they get allocated? I think we were discussing,
For health insurance?
let me go to B5. I think we were discussing health and dental.
No, the health department is not charged insurance. The operating budgets, the individual municipal operating budgets are not charged for the health insurance. It's embedded in the electric utility administration budget, and it's embedded in the water utility administration budget, and it's embedded in the library budget.
Only, those three only.
Well, no, then plus the municipal budget. So the municipal budget holds all the health and dental fees for the municipal departments.
Okay.
That's the catch-all.
That's correct.
Yeah, the operating assumption would be everybody's in there except for A, B, and C.
Yes. A, B, and C being water, electric, and library.
Right.
That's a good question.
See,
Since they are
they're a separate entity.
But they build, I'm quite certain when they do their pricing, they build the health insurance into their costs. I'm absolutely certain of that. I'll get you an answer on that. though.
Yeah, I wouldn't take it for granted.
Yeah, Dan, they do.
And I would,
So it would be,
That's
and-
right. So
and-
it would be.
I mean, hell,
it would be in their overhead. We didn't see that in their budget, did we?
It's not a line item in their budget.
It's not.
No, just like it's not a line item in anyone's budget, once again,
Right.
except,
yeah, but except, Robert, we don't bill out to third parties based on our cost of employees as we do to health department employees. Who, that was the conversation we had with John and the doctor earlier. The whole challenge, I think, with the health department is trying to figure out what number accurately reflects our cost of employees and how those costs should be shared with the other municipalities who contract with us for those services. If we do not have available to the health department an accurate reflection of what their employee costs are, because while salary is separately stated on their budget, health insurance is not, then in all probability, we are not accurately reflecting the cost to run the health department. And by extension, we're not accurately reflecting how those costs are appropriately shared with our contracting municipalities. Which is
John,
a
I-
whole different element
Okay.
in discussion, but I think, if I understand, that's the question that's arising.
John, I'll verify that with Lou DiBiase and other members of the board, but I communicated with Bill Rosenberger specifically what the fringe benefits are. They're certainly well aware of them.
Yeah, but it certainly, to me, it doesn't make, to keep it simple, it would make far more sense to have it over there unless there's a statutory reason not to do it. It's not gonna change the bottom line at all, but we wanna, as we have these standalone entities, you wanna understand what the true cost.
Part of the calculation for allocating fees to our contracting partners.
Okay.
And I think the challenge may be as well, is to see if there are any other situations where we're sharing costs with other municipalities or entities, and if, in allocating those costs, we are reflecting the full cost of an employee, meaning salaries as well as health, insurance, et cetera, et cetera.
Yeah, I agree.
Okay.
The other item I wanted to call to your attention is line, account 513. Account 513, that's dues. This is dues to the New Jersey Public Power Association, and John and I and Ray have had some discussion about this. We've been a member of the New Jersey Public Power Association for 22 or 23 years. About a dozen years ago, a position and a budget was created for the executive director. Ray and I have discussed this. So we're essentially paying dues to fund this position and these expenses. We've been doing this for a dozen years. Ray and I agree that we should no longer do this. I've discussed this with one other large member, which is the Butler Utility. They came to the same conclusion. What I'm recommending is after 2009, we resign. We give them notification. The budget was passed. The budget was passed in early January. I discussed with Ray about funding 6 months, but since we've been a member for so long and they passed the budget, in all fairness, I'd want to restore this back to our dues assessment, I think, is $28,400. Send them the $28,400 simultaneously resigning.
As of 12/31/09.
That is correct.